Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
America is seeing a sharp increase in the number of opioid-related deaths. Nearly half of all overdose deaths involve prescription opioids. This has forced a nationwide push to reduce the number of these types of deaths. Today we'll take a look at the issues leading to this nationwide epidemic, and along the way learn what's being done to curtail opioid abuse and misuse. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Janet Whitmoyer. Stay tuned. Welcome back. My first guest is Dr. Philip Steele, a family practice sports medicine physician here in Helena. Thanks for joining us, Dr. Steele.
Thank you.
Okay. I wanted to start off by asking, why are so many people who are on opioids still in pain while on these powerful drugs?
Well, that's a great question. The problem is that many of these medications decrease the threshold at which you perceive pain. So simply speaking, if I were to pinch my hand right here and I pinch it lightly, I shouldn't feel any pain. But as I pinch it harder and harder and harder, at some point I'll perceive pain. What fentanyl and morphine and many of these medications do is lowers the threshold. So the amount of pinch that I need to pinch here to create pain changes. And so the more I prescribe an opioid medication, the lower my threshold to perceive pain is. And fentanyl is a horrible example of this. It's a medication that's made many Americans dependent on this stuff, because as physicians, we're like, oh, you poor thing, you're in pain, let's give you more. And we're actually compounding the problem. We're actually making them more sensitive to pain, so that if we just briefly touch something or have pain shooting down our arm, we just barely touch them, they're like, oh my gosh, we need to help you. And as physicians, we got into being physicians because we want to help people, and we don't want you to suffer, so we give you more. And that's actually compounding the problem. And as a physician, we weren't taught about this. When I went to medical school, nobody even talked about this. I go to conferences and nobody mentions this. So it's really important as a physician and the public to be aware of this issue, that we're actually making the problem worse by prescribing these medications.
Okay, great. Can you tell us a little bit about what opioid-induced hyperalgesia is?
Well, that's essentially it.
Okay.
It's by using opioid medications for chronic pain, we're actually creating more pain in some of our patients. And it's thought to be only a small percentage of patients initially had this rare complication. But we're learning that more and more and more that this is a much higher percentage of the population. In my clinical practice, I see it all the time. People come to me, they're on fentanyl, they're on breakthrough OxyContin tablets, and they come in and I just barely touch them, or I just try to move them for an examination, and their pain's out of proportion to any of the problems they have. And so the physicians keep giving them more, and that's not the answer to this equation. The equation is fixed by getting them off of this medications completely.
Okay, so can you talk a little bit about how you would treat somebody and what the treatment would be to get them off of that? I can't imagine you just say no more.
Well, the problem is, patients come in and they say, I'm in pain, you want to take this away from me? The initial response is, are you crazy? And so I need more of this stuff. And so it's a paradigm shift. We have to educate our patients that pain is actually okay. When you have an operation, we say, oh, you need these pain medications because you're going to have pain post-procedure. Well, what if we change the paradigm to say, oh, pain is good. You're going to have healing pain as part of this procedure. You're going to experience the healing pain symptoms after the procedure. So we need to change how we discuss and talk about pain. We can also, there's medications to help get people off pain. We can use long-acting methadone. We can use clonidine for some of the symptoms of withdrawal. There's naloxone, which is a medication to use for overdose and for dependency. So there's lots of medications that can be used, and under the care of a physician that's familiar with getting someone off this, you can use those medications. But the biggest part is just the sales pitch. I have to convince my patient that at the end of the day, if I get them off of these medications, they'll have less pain than they have currently, and that's a long, complicated subject. And the first time I meet a patient, they're like, oh, there's like no way that's going to happen. But as you continue to work with the patient, that's why I do a lot of nerve blocks and I do other procedures to try to get them to the point where they're using less and less of it. So we convince them that if I can get them off, they'll actually hurt less. And they start to see that, and they start to notice that they're feeling better. Realize that opioids decrease testosterone production. And women and men need testosterone to heal. If you have chronic opioid dependency, you're on chronic pain meds, your testosterone level goes down. So your healing potential decreases, you're depressed, sexual desire goes down, lots of things are depressed. Suicide rate go up, depression's huge, everything changes by being on opioids chronically. And so once they start coming off it, they notice that they're less depressed, they can become more active, they can start to go back to work, they can do many things. So a lot of people that are on chronic pain are habituated to the point where they just sit at home and do nothing. And so, studies looking at just active lifestyle versus antidepressant medications, which wins in terms of being more effective? Being outside in the sun, the babbling brook and the birds singing was more effective than antidepressants. So we need to start looking at changing the paradigm, how we speak about opioid dependency, how we talk about pain, and then how to get our patients active and so that they feel better, and then convince them that by doing so, they're going to improve the quality of their life.
Great information. So on the flip side of that, do you think that there is an option for opioids for some patients, or is that something that we should get away from prescribing altogether?
Well, there's a difference between acute pain and chronic pain. So you roll down the stairs and you break your leg. There's good evidence to support that short-term opioid use, 5 to 7 days, is not addicting, not low potential for addiction risk. And so we need to kind of convince our patients that we're going to give you this medication, and it's only for the acute onset of the pain. And then after 5 days, we're going to transition you to something else. We're going to start physical therapy. We're going to recommend acupuncture, maybe chiropractic care. We have all these other options, TINS units. There's lots of modalities that we could do. If you just cut them off with nothing to hope for, they're like, well, I need another doctor to give me a pill.
Okay. Oh, awesome. Well, that is really good information. So helps us to know when it's appropriate and then when other types of treatment are more appropriate for treating pain. So thank you very much, Dr. Steele, for being with us. We'll be right back to hear from the Department of Justice to learn what they're doing to reduce misuse and abuse. So here in Montana, stay tuned. I want to welcome our next guest, Eric Sell with the Department of Justice. Welcome, Eric.
Thanks for having me.
Thanks for being with us. I wanted to start our discussion off on the national level. Can you tell us what's being done regarding the elimination and overuse and abuse of opioids?
Right. So one of the greatest public health threats facing our country right now is certainly the opioid crisis. I'm sure you've heard about it. I'm sure the viewers have heard about it. It is really damaging to communities across the country, and it really has policymakers at all levels of government focused on solutions. Right now, when you look at federal efforts, you have the Center of Disease Control, who have issued guidelines that they recommend physicians follow to eliminate or at least mitigate the overuse of prescription opioids. But that isn't enough. You still see deaths far too often. You see folks moving from prescription opioids to cheaper but more dangerous heroin and fentanyl. It really is something that is a great challenge that's facing our country. And it's a challenge for us here in Montana as well. Attorney General Tim Fox, my boss, started an initiative last April called Aid Montana, addressing the impact of drugs to address not just opioids, but all substance abuse. Because when you look at substance abuse, you can't just focus on opioids or methamphetamine or alcohol. As policymakers, we have to look at this in a comprehensive fashion. We have to understand that substance abuse is interconnected. But what you're seeing on the national stage with the opioids is certainly the most dire, just because of the amount of deaths that are the result of the opioid crisis. And much of that has been driven by overprescribing, and misuse of those prescriptions by those who've been prescribed those prescription drugs.
Okay. And so I kind of want to move it back to Montana. You mentioned that there's some activities happening here in our state. Can you elaborate and let us know a little bit more about what's going on in Montana to combat this?
Right. So as I mentioned, Attorney General Fox's initiative, Aid Montana, is right at the forefront of addressing the substance abuse issue in the state. But I wouldn't want to mislead anyone to think that there aren't other great efforts out there to address substance abuse and address the opioid epidemic. The Department of Public Health and Human Services has also convened a group under a federal grant to take a look at opioid overuse and abuse in the state of Montana. And they've kind of morphed that from opioid specific to this entire substance abuse problem, taking a look at this holistically. So what we've seen up until now are a lot of well-intentioned efforts doing some great things, but it's not enough. We found that there's sometimes a lack of communication between the law enforcement world and the public health world and the education and prevention world. So what Attorney General Fox's Aid Montana initiative aims to do is to break down the silos, if you will. So folks in the law enforcement world are talking to those in the public health world. Because if you don't have communication between the different efforts, you're not going to have a coordinated, efficient strategy to combat this problem. So that's really the purpose of General Fox's Aid Montana initiative, is to develop a comprehensive strategic plan where everyone who is fighting this battle are communicating with one another.
So is Aid Montana really in the development stages, or have you been able to implement any specific actions regarding that?
Right, so it's a little bit of both. We started this, as I mentioned, last April. We've conducted a number of meetings. I've been involved personally in probably 50 plus meetings so far with different organizations, both in government, outside of government, public sector, private sector, the nonprofit world, the healthcare world, law enforcement community. And what we're trying to do is develop some policy proposals that we can bring to the 2019 legislature. But we're also understanding that this is an immediate crisis. And we need to do everything we can before the 2019 session as well. So what we've done at the Department of Justice is worked with the last legislative session to get funding for 6 new highway patrol troopers whose sole goal is to address drug trafficking in the state. This is our new criminal interdiction team. They're working with our Division of Criminal Investigation agents, the federal agents within the DEA and the FBI, and of course our local law enforcement partners to crack down on those who are trafficking large amounts of methamphetamine and heroin into the state of Montana. So that's all a part of the Aid Montana initiative as well. It's kind of the enforcement arm of this. Like I mentioned, there's the treatment side of this, the enforcement side, the monitoring side, and the education prevention side. So anything that we can do before the 2019 legislature with existing resources and existing authority and partnering with nonprofits and local governments, we're actively seeking ways to do that as well.
Okay. And I wanted to touch, we only have a little bit of time left, but I wanted to touch on actions that you or the Department of Justice is taken on behalf of Montana in the federal courts. It's my understanding that your office has filed a preliminary injunction regarding a pharmaceutical company from deceptive and unlawful product marketing campaign. Can you just briefly describe what that's all about and what's going on?
Sure. So last December, we filed a lawsuit against Purdue Pharmaceuticals. They're the manufacturer of OxyContin. And what we found through an investigation is that Purdue Pharmaceuticals would deliberately mislead and misinform physicians to believe their product was safe and non-addictive. So we filed the lawsuit last December in Montana District Court because we were raising state consumer protection claims. Right now, we filed a motion for preliminary injunction, as you mentioned, to hopefully ask the courts to stop Purdue's marketing campaign. Right now, it has been moved to federal court. So we're trying to work this all out, get it back into state court where it's in a Montana forum, because there's lawsuits against Purdue across the country, and they've kind of all consolidated, if you will, into a larger case in the state of Ohio. Kind of a lot of background noise in this case, but that's the status of Montana's lawsuit.
All right. Well, thanks, Eric, for sharing great information on what's happening in Montana regarding this terrible epidemic. Up next, we'll be getting a pharmacist's perspective on the opioid epidemic. Stay tuned. Welcome back. My next guest is Lisa Sadler, a pharmacist with Mountain Pacific here in Helena. Thanks for joining us, Lisa.
Thank you, Janet.
So I want to start off with asking you about the opioid epidemic and how it really became a nationwide crisis.
Sure. The opioid epidemic is a dramatic increase in prescription drug abuse and overdose deaths that we have noticed between 1999 and 2016. And really, it's important to note that although opioids do have important medical uses, they definitely have adverse effects. They bind to the receptors in the brain that can cause a feeling of euphoria, well-being. That's the reward center in the brain. And in susceptible individuals, this can lead to an increased risk of opioid use disorder, addiction, substance use, misuse, and even serious consequences like overdose.
So why are opioids so addictive?
Right. So opioids, as I mentioned, they bind to the opioid receptors in the brain and increase the levels of a chemical neurotransmitter called dopamine. In folks, again, it's important to mention that are susceptible individuals, and some folks are not necessarily susceptible to addiction or dependence, but in susceptible individuals, this can lead to wanting to use more and more of a drug at any given time to create the same effects, and that can lead to addiction.
Okay. And I heard you say this, but I've heard it frequently, the terms dependence and addiction.
Sure.
Do they mean the same thing, or are they two totally different things?
So that's a great question. They are not exactly the same thing. So addiction basically means the continued use of a substance over time despite negative consequences. And this can have both physiological and psychological components. And so the physical kind of components of that, or excuse me, the psychological components of that would be things like uncontrollable craving, compulsive use, inability to discontinue when you feel like you need to. And then the dependence part of it is actually the physical side of that. So dependence basically means, you know, your body becomes accustomed to it over time. And there are two components to dependence, and that would be tolerance, meaning you have to use more and more in order to produce the same effect. And then withdrawal, you would note if you abruptly stop taking the medication. So dependence is a component of addiction.
Okay, so that's a really good distinction, so thank you for making that. So we've heard a lot about the epidemic, but now we're starting to hear a lot about reducing the opioid distribution or usage. Can you talk a little bit about that trend now?
Absolutely. So on the heels of the increased use of prescription drugs, misuse of those, overdose deaths that we've noticed in this period of time, we've had a lot of guidance that's come along the way. In 2016, the Centers for Disease Control actually released a new prescribing guideline to help providers in the community prescribe appropriately, more safely, more effectively for patients for chronic pain. It's important to mention this isn't relative to those who are treating cancer pain. It's really chronic, non-malignant pain. As part of that, what we have seen is a reduction in dosages that are being used, a reduction in duration of prescriptions, typically 3 to 7 days for an acute injury, because we know that longer-term use is associated with a greater risk of opioid misuse and substance use disorders.
Okay, so are there actually unintended consequences to the actual decreasing or the reduction of the use of opioids?
Yes, absolutely. You know, we're starting to see those now. So as a result of more prudent prescribing of opioids, we are seeing an increase in heroin overdoses. So because prescription opioids have become now less readily available to folks, we are seeing a transition to heroin. It sometimes can be cheaper to buy on the street. We've also seen an increase in suicides, and so that is an important thing to keep an eye on, because a lot of those folks who have chronic pain, terminal illness, severe medical conditions, there are a percentage of those who have had narcotic painkillers in their system, and so it's two things to definitely we're monitoring.
Wow, that's a really difficult dilemma.
Yes.
So if there is a person who is on opioids and they want to get off or reduce, what advice would you have for them to do that?
Yeah, it's always a risk-benefit conversation that you would like to have with your provider, and so there are certain tapering schedules. Providers can work with you on that in order to discontinue the dose over a period of time to help you avoid uncomfortable side effects or withdrawal symptoms. So that's important to talk to your doctor.
Okay. And so with the opioid use disorder, what are some of the medications that can be used to treat it?
Sure. So for the actual opioid use disorder, there are prescription medications to use, useful to treat those. They are actually opioid in nature. In some respects, Suboxone is one that is available for specially qualified providers to prescribe methadone in special treatment centers. Vivitrol is another one that's an injectable medication. So there are several out there. If you're diagnosed with that condition, you can receive medications to treat that.
Okay, and just real quickly, I have one other question. For folks who have overdosed, or if there's
Yes.
those situations of that, is there a medication that can be used to treat that?
Yes, that medication is called naloxone, or Narcan brand name, and it is useful in the accidental overdose of narcotics, either unintentional or intentional, and it actually helps to reverse the respiratory depression associated with that can be lethal and cause death. It's very short acting, lasts for about 30 to 90 minutes. Important to get folks to an emergency room or call 911 if it has to be administered. Montana actually has a standing order for it now. You can talk to your pharmacy about that.
Perfect. Thanks so much for the great information, Lisa.
Absolutely.
Well, that's it for this week. I want to thank Lisa Sadler, Eric Sell, and Dr. Steele. I'd also like to invite you at home to tune in next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.